since you've started the podcast and the feedback you've gotten, what is it that nurses are most seeking to know? What do you think that's lacking out there in nursing education that they're getting from your podcast?
I love that question because that's really what drove me to do it in the first place. I think nursing school prepares you to pass the NCLEX. So like you learn how to answer the multiple choice question. But what I hope to teach nurses is when you walk into a patient's room, what do you actually do with that knowledge? No one's asking you multiple questions. Would you like to do A, check the airway, B, check like no one does that. So learning how to apply that head knowledge into real clinical scenarios, and I try to really walk that through as I'm describing, and then I approach the patient, and then I assess for this, and then I said this, and then this was their response, and here's how I responded to that, and then we discovered this. So just helping nurses kind of like see themselves through the eyes of the case that I just experienced. I don't think there's a good place for that in nursing school. Like it's hard to really make that happen, especially because you can't orchestrate real emergencies to happen in a clinical setting. I mean, you can do simulation,
Right.
but simulation is way less stressful than the actual patient who's declining. And so I hope that I can like relay what I'm feeling, what I'm seeing, what I'm experiencing, what I'm processing, and kind of teach nurses to process it the same way. I did not have this skill set when I was a new grad. All the things that I'm teaching, all the critical thinking, all of like the years of seeing patient after patient after patient with this presentation has led me to the ability to recognize, oh, that's the signs and symptoms of a AAA. Oh, that's the signs and symptoms of a patient who's going to septic shock. Oh, this is a patient who's herniating. Like I've seen it enough that now I can critically think to that conclusion. But I want to like help people take a shortcut from just having the head knowledge of like, this is what the diagnostic criteria are, or this is Cushing's triad on the test, but to actually like see it evolve in a real patient, I feel like is what nurses are hoping to gain from the podcast.